So, Darcy's Corner. I think a lot about transgender rights. There's that hashtag transgender rights or human rights. And the problem, I should disclose something. I live in Canada. And so we have a healthcare system here that is fairly robust. And it's essentially free to use for everybody. But it's not freely accessible to everybody. And medications aren't free either, by the way. So we either have to have a drug plan or we have to pay for our medications. So everything in Canada is not perfect when it comes to healthcare, and certainly when it comes to transgender rights. But I recognize it's better here than it is in many other countries. And so my situation, even though it's very frustrating for me to deal with, I know that I have a lot of privilege. I know that I'm very grateful for what I do have. But it definitely needs to get better, and it's definitely frustrates the hell out of me when I have to go argue with the doctor and try and convince them that I need their assistance, because that's insulting and it's ignorant, and they'll say stupid things like, well, you're not going to die, so what difference does it make? And you've already put up with it for the last 40 years, so really, like, what do we care? And I'm paraphrasing very, very mildly. Like, there's some very almost turfy information coming from my doctors, all of whom are female, by the way. Um, there are many medical options for people like myself. And because we talk amongst each other in the community, we go to group meetings and we go to community centers, and Reddit is right there. Eventually, if you're paying attention, if you're looking, you will learn what the different medical options are. You'll go, you can do A, B, C, or D. What do you need for your situation? And lots of things are factors, right? Age is a factor. Your current gender, what you're trying to achieve in your transition, how much you want to transition or how little, where you fall on the spectrum. And these are things that take time to learn, by the way, for the individual. There's a reason why when we're helping children with this in today's world, they have a psychologist and they've got like doctors and they've got people involved in the community who are teaching them how to know who they are. And the reason we do that is so we can avoid detransitioning, which happens sometimes. And if you are a person who's gone through this and then detransitioned, there's no shame in that, none whatsoever. This is confusing for everybody. And so if there's aspects of this that didn't jive with you the first time, or like, you know what, really, I really wasn't trying to be him, I just wanted to wear jeans more often. Like, this is a very complex subject. I paused the video because I was stumbling over my words, and I'm still looking at the wrong spot on the camera. But here's the thing. This is complicated for us, right? But when you have an adult who has properly assessed their situation and knows what they want and knows the proper medications to get there, and the only reason you're telling them no is because you don't feel like it or because that doesn't work for you at the moment, and then you tell them something stupid like, well, you're not going to die from this. So you're telling me I have to go slit my wrists. I have to commit to the fact that I am so freaking sad and upset with my life that I'm willing to go die. Now you will help me. That's what my doctor told me. She said, well, you're not going to die from this, so I don't have to help you. So in other words, based on her information, I should have slit my wrists and wrote her name in blood on the fucking wall, and that would have been okay. Then she would have helped me after I was dead. That's a horrible thing to tell somebody. And it's stupid. And you wouldn't apply that standard to anything else. You wouldn't go to a 14-year-old girl who came to you and said, I want estrogen. I want birth control. You wouldn't say, well, you're not going to die if you don't get estrogen, so I'm not going to give it to you. That's not the argument you would use. That's the argument my doctor used on me. You're not going to die if I don't give this to you, so you don't need it. Like, this is a very difficult decision for people to make. And when they finally get there, especially if they spent years, like I spent 10 years thinking about it. I think I thought about it long enough. I think I'm an adult who can make a decision on what I want in life at this point. So for you to patronize me and tell me I need to think about it more, that's upsetting, right? So what's the point to this rant, this ramble, other than me cussing and being angry at my dealings with doctors? I think that trans rights is something that we need in Canada. Well, in Alberta for sure, but definitely in Canada. And the reason we need those is because trans people have different needs than cisgender people. And the system does not recognize that or understand that or even care even that much, really, that we have different needs. And it's to say that we don't want to be monitored would not be true. We want healthcare professionals looking at our blood work and telling us what the numbers mean. We want people who are trained, who understand how these different medications work. But really, it's not that big a stretch. If you can prescribe birth control pill to a 14-year-old kid or a 32-year-old woman, you can prescribe it to me. It's the same drug. You have to know how that drug works on me, but that's your job. You're a doctor. You spent 10 years in medical school. I didn't. So yeah, I expect you to do your job, to know how the medication is going to affect me. My doctor told me she had zero intention of looking at my medications, any of the ones I needed at all, and she was never ever going to. Well, then why are you my doctor, was my question to her. At which point she recommended a different doctor. But she could have done that 3 months earlier when I came to her and said, I'm transgender, please help me. And she didn't. She said, well, if your transition takes longer, that's really not my problem. The longer my transition takes, the harder it is for me to get a job. The harder it is for me to function in society. Delaying these things because it's inconvenient for you, the medical professional, is unprofessional for one. Okay? For another, I don't have time to wait. And you're stopping me. Sorry, I had to pause the video there. You could see I was getting worked up. This entire system has me very angry. And the reason it has me angry, I lost 6 months of transition time where I could have been transitioning physically into her that whole time, and it was lost just because my doctors didn't feel like it. Even when I changed doctors, the next doctor I was their first transgender patient, so they were like being extra cautious with extra blood work and extra whatever and delaying things, not because of anything medically wrong with me, because they were uncomfortable. That is not a good enough reason. I'm sorry, it's just not. My life has to move forward whether you're comfortable or not. I can't wait for you to be comfortable with my transition. It doesn't work that way. My life has never worked where I have to be comfortable, someone else has to be comfortable with my life so I can move forward. Like, why would I live my life like that? Do you live your life like that? No. My point is, as a consenting adult who is educated and taking the time to learn about the different things, access to medications I need, or the surgeries I need if I need them, or whatever medical help I require, should be my right. I shouldn't have to fight with people over it. I shouldn't have to argue over it. And it's not that I won't listen to medical professionals. If they say, hey, you have a blood pressure issue or a liver issue and this particular medication will aggravate that and cause a heart attack, then yeah, obviously I want that monitored and or changed if necessary. But you can't just go by the thing, well, it's possible that this side effect might have from this medication. Every medication has the possibility of side effects. By the way, estrogen, a possible side effect from that is cancer. That's always true. We take that risk every day, and yet millions of us don't get cancer from taking the pill or whatever form of estrogen you get. Um, so I am not reckless. I want to be monitored. I want medical professionals guiding my situation. But I also want all my options on the table. And if I know there's an option over there, and the only reason I can't have that option is because that doctor has decided, hey, you don't get to live your life. I decided you don't get to live your life this week, or this month, or this year. I've decided that maybe in a couple years from now, if you're still alive and if you still have a job, then you can maybe transition. Just because I decided that. No, I'm not okay with that. That makes me angry. And it should make me angry. I deserve to be able to live my life, and I don't need to explain that to you. Or anybody else, really. Let me post a follow-up to this, and the reason why I'm so angry about this and so passionate about this. When my first general practitioner agreed to start helping me, all she would agree to do was to prescribe me blood pressure medication, which is spirolactone, which is a common suppressant for testosterone. But it isn't really the best suppressant for testosterone. It's just the most commonly prescribed one. But I was desperate, and I would take anything I could get at the time. And I was really trying hard to transition. And I'd already told my people at work knew, my family knew, my life was already blowing up as far as my transness coming out was already concerned. So I couldn't see why I wouldn't just keep going. And at one of the trans meetings I went to, that one person talked about spirolactone and how it was a blood pressure medication. I thought, I have blood pressure medications. Why don't I switch to that one? So when I went to my doctor, but I'd already told her I was trans, I'm like, look, I want to switch to this blood pressure medication, but I'm doing it to suppress my testosterone. And she says, okay, I'll do it. But she was real hesitant about it. She goes, but if anything goes wrong, anything at all, I'm cutting you off. I said, okay, fine, because I was willing to take anything I could get. And I'd already asked her for estrogen. She said she wouldn't just because. Anyway, so now the only thing I can get is the Spiro. I've already blown up my life as far as telling people about my transness goes. And like 3 months in, I just come back from another meeting with, I don't know, a community center, talking to somebody who is knowledgeable on different forms of blockers and estrogens and that sort of thing. And it was a great meeting. And I don't know, maybe an hour after I got in the door, well, I'd done different activities that night. I delivered my route, and then I came home, and as I walked in the door, my body locked up. And I had what I have to assume was a seizure. I've never had one before in my life, and I had heard that if you were on blockers and didn't have another hormone replacing it, that your body goes into seizures, or could go into seizures. Now, I didn't know if that's what was happening. I didn't know if it was a negative reaction to the medication, but I assumed it was a negative reaction to the medication. That scared the shit out of me. Not only did it scare the shit out of me, I couldn't go to the hospital. I couldn't tell the doctor, because if I do that, she's just going to cut me off. And she's not going to give me different medication. She's just going to take away what I have. And I had been struggling with my transition and my decision to transition for so effing long, I was willing to die and risk my life. Okay? If this is going to give me seizures that are going to kill me, I'm going to do it anyway. But the problem is, I don't have the right to do that to someone else. Right? I don't have the right to be driving my vehicle and have a seizure and kill somebody. That's not right. So you better believe, like, the next day I was on the phone and, like, I want my medication changed. I want it changed right now. Like, it's got to get done. And so when I finally got in there to see her, she was like, why is this such a big deal? But I can't tell her why. Because if I tell her, she's just going to cut me off. So I didn't tell her why. I just said, it's got to be changed. It's got to be changed now. I want something different. How do we fix this? That was when she recommended a different doctor. But she could have done that 3 months earlier. So I'm lying there on this very couch that I'm on right now, thinking I'm dying. It wasn't going well with the marriage at the time. The wife had zero sympathy for me. And it's all because of this turf shit. It's all because of this lack of rights for people like me to be able to live our lives the way we choose. That's why I'm so mad about this. My video is getting way too long now, but yeah. Transgender people apparently do need special rights because you can't treat us like the rest of the population. We're different.